You're always human first, journalist second. In many years ago, I knocked on a door here in Baltimore, and a woman threw bleach in my face. I hadn't even spoken. It was unprovoked. She was mentally ill, and I obviously was rushed to Johns Hopkins Hospital, and they were able to save my eyesight.
We had a mass shooting in November, Sutherland Springs, which is, it was the church that was shot up, and a number of people were killed.
I remember a time when I was a reporter in southwestern Ohio, got sent out to cover a flash flood that water from a massive thunderstorm came down a valley and 23 people died. And covering that story was was amazing and difficult at the same time, you know.
Recently, we had a 2-year-old fall into the Mississippi River and drowned, and 2 weeks before that, we had a 5-year-old girl fall into the Rock River and drown. And there was several days that we couldn't find the children, and the rescue crews were out there looking, and every day my reporters were going out to follow up, give the latest, talk to family, and I knew that it was weighing on them. You could just tell.
That is in Columbine. We spent a week in a park right outside the high school in Littleton, Colorado, and covered the story day after day after day, and really we're not as affected as we thought we should have been. And then all of it came pouring down on our shoulders about a week later after a memorial service was held.
I don't know if the help comes from management necessarily. It really comes from colleagues, that we help each other, we watch out for each other. When you get back in a car and a photographer and reporter are sitting there, you say, are you okay? Do you need to talk? Are you okay?
We brought in a number of mental health professionals the week after that happened. That happened on a Sunday.
That time I really dealt with it on my own. There really was not a culture at that time where news managers really thought heavily about those things. But my experience as a reporter really helped me when I became a news manager and then began managing these kinds of circumstances on my own.
Open line of communication. I try to meet with them after the stories and then see how, kind of gauge how they're feeling. And then in addition to that, we always let them know that the company has a system in place where they can find somebody to speak with if they need to.
I can only talk about the places that I've been, and I do know that reporters are more apt to have conversations about it.
All human beings. In fact, I think you're a better reporter when you're human, and you do understand where they're coming from, but you have to be able to talk about it with your colleagues and know that you still have a story to tell, and it's their story to tell, and that's how you get through it.
Sometimes a journalist just needs somebody to tap them on the shoulder and say, would you like to talk? Because we're conditioned, I think, in a lot of ways not to be open about what we're feeling while we're covering a story, not to be open about what we're feeling after we're covering a story.
The first mistake is to push the psychological impact of what you do for a living to the side. You have to acknowledge it, and as a news manager, you have to understand that people get affected.
Not feeling confident in yourself, it's hard to be able to tell the stories of other people in your community, and I feel like it's time. I mean, I've been in this business 30 years, and that hasn't always been the case. You know, it's always, it had been, you know, suck it up, this isn't your problem, that you're detached, you're supposed to tell the story. And it's good to know that finally our industry is acknowledging that you can't sometimes extricate yourself from a situation.